that this lectures or teaching today is coming to pass. Thank you so much. And I especially want to thank the SWA initiative for all that you do. I follow you on your handles and I see everything you're doing. And I want to say thank you for all that you do. And especially the CEO, I want to appreciate you for this great opportunity. I see it as an opportunity to speak on this topic, understanding trauma in sexual abused children. Thank you, and I welcome everyone to this session, and I want to believe that you will continue to follow as we dive into the trauma that affects children who are sexually abused or were sexually abused. Thank you so much. Can you share my screen? Yeah. All right. Can you hear me?
Yes, we can hear you. I don't know if you can see your slides. If
I'm
we
not
can
seeing it. Okay, let me just continue. I can't see it, but I can use the one I have here. I can't see it. Okay, now. Okay. All right, thank you. Yes, this is good. I can now see it. So we're talking about sexual abuse in children, understanding trauma in sexually abused children. And, you know, sexual abuse is a serious issue that impacts children worldwide. It's a serious issue. And many of our children are going through the impacts of sexual abuse, which most at times we are not aware of. And its effects can last well into adulthood, touching every area of their lives. There are a lot of adults today who are going through so much, not because of what is happening to them presently, but because of the past, what they had gone through as children. And the impacts vary by individual, but show consistent patterns across emotional and psychological health, behavior and social functioning, physical well-being, relationships with others. When you see people finding it very difficult to relate with others, even as adults, it's an indication that something happened. And like I said, it's not necessarily that it happened now. It's possible that they carried it over from childhood. And early recognition, of course, and intervention can change a child's life. This presentation equips you with knowledge to recognize, respond, and support and support others who are going through this kind of issue. We are going to see the definition of trauma and how it impacts on children. And there are a lot of you that have idea about trauma. I know so many of you that have joined this teaching, you know what trauma is, or you have come across, or you have heard about the name trauma. And like we all know, there are different definitions to trauma. And for these lectures, I want to define trauma as a deep psychological wound caused by a frightening, distressing, or overwhelming event. It disrupts normal functioning and can trigger lasting feelings of helplessness, hopelessness, and loss of enthusiasm for life. It's a deep, some other definition will say it's a deep wound in the heart that overwhelms the coping capacity of an individual. It's a wound that is caused by a frightening event, that is caused by something that happened in the past. And until that wound affects your normal functioning, then it cannot be called trauma. It is when the wound is affecting the normal functioning of an individual, making that individual helpless and hopeless, we cannot say the person is traumatized. We say a person is traumatized when a wound in the heart affects the normal functioning, and when there is an experience either in the past or in the present. And another thing is that it disrupts the brain. You know, it rewires how the brain processes safety, memory, and emotions. As normal as trauma can be, it can affect the functioning of an individual. It can affect the functioning of a child. It affects the whole body. You know, there is something we call stress hormones. The sleep, appetite, and physical health are all impacted. It affects a person holistic, the whole of a person. Trauma can affect everything, the body, mind, and soul. And like I said from the beginning, it varies by person. The same event can happen to a child and he will be able to overcome it, and another child cannot overcome it, depending on the environment the child is coming from, the support system around that. A child, if not, that child can carry that impact into adulthood, and it can affect the normal functioning of a child. And you know, because we are talking about children, at times it is very difficult for a child to explain how or what happened to him. There are children that went through so much, but they can't explain what exactly happened, or they don't have the right words to explain. At times, some of the children are muted by their abusers. But the response, there is a response that they automatically get into that we call it survival instinct. They get into some kind of coping mechanism that makes them to hide under something, to be able to run away from the past thing that happened.
Family.
So you see, these children, there's something we call fight, freeze, flight, and fawn. And it's a survival instinct. The children, because they cannot explain, they cannot say exactly what happened, they get into a mood of fight. They become aggressive, they become angry, they fight. They can't explain. So the only way they can do that is to fight either their peers or they are always angry. You find out that a child is always angry, is always fighting his peer group. Something is wrong somewhere. It's a survival instinct. He's just trying to cover up. Some of the children fight, some of the children flight, and to flight is to run away. They avoid anything that will make them remember what happened. They withdraw from social life or from people who are their family members. And you know, most of the times, I don't know if we will talk about that later, but most of the times, children get abused by people around them. I have had cases of a child being abused by an uncle, either the mother's brother or the father's brother, drivers, cooks. And it's not only a gender thing. Boys are also abused on daily basis. Girls, you find out that people who are close to the family members, they are always the perpetrators. When you leave a child around people who are not biological their parent, in fact, there are children that were abused by their parent. So one thing is that they run away. You see a child constantly telling you that I don't want to go here. I don't want to do this. I don't want to be with this auntie. Probably that auntie is abusing the child. Or I don't want to go to school again. So they run away. Another thing is that they freeze. They become numb. They disassociate, inability to speak or more. You find out a child who is a happy child, always happy, always running around, always playing, suddenly become numb. That child is not talking, he's not associating with people, he's not playing. Something is wrong somewhere. The child is freezing. And one thing that initially we always talk about fight, flight, and freeze. Then recently we discovered that some of the children or even adults, they fun. Fun is when you just want to be the good person. You want to please everybody. You want to be noticed. You want compliments. You want people to say, oh, she's a good girl, or he's a good boy. Just be able to cover up. So these are some of the responses that children can respond when they cannot explain what actually happened. They get into this mode of fight, freeze, and fun. And there's an impact on those children. Apart from these responses, there's impact. Some of these impacts can be emotional and psychological. And emotional and psychological effects can be persistent to overwhelming worry, startle response. The child can just begin to fidget over something that is not there. That child can have a low self-esteem. They tend to believe that they cause what is happening to them, especially when they are not around people who can support them. And when they are around people who can easily blame them, so they begin to feel ashamed of what happened to them. There's these symptoms of post-traumatic stress disorder, the flashbacks. At times you see a child can just begin to shout in a dream or in his sleep or in her sleep. Children can begin to re-experience what happened in their sleep. The nightmares, they begin to say certain things in the dream. If you're not sensitive enough, you will not understand what is happening. You will think it's just a mere dream. But mostly children get a flashback from their sleep because of what happened to them. There's depression, the withdrawal, the sadness, loss of interest in activities. A child that's normally will want to sit down and watch cartoon or want to play with some toys suddenly begin to withdraw and stay alone. That's a sign of depression. Trust issues. Yes, you find out that children begin to suspect just virtually every adult. I engage with a teenager of 13 years that told me that all adults are wicked. I was like, no, not all adults are wicked. Say, no, all adults are wicked because the father is busy, the mother is busy, he is always with his aunts and some other relatives, and they were not treating him well. Some of them abused him. And male to male. And he just concluded that all adults are wicked because of what he went through. So it's very difficult for him to trust any adult because the adults that were to take care of him ended up abusing him. So he concluded that all adults are wicked. Difficulty forming safe relationships, especially with adults. Identity confusion, especially in adolescent. So these are some of the things that, and much more, that children can go through as a result of abuse. And you know, I put a case study here of abuse. The situation is abuse by a family friend. Like I said, some of these abuses are done by family members or close relations or domestic workers. The parent noticed Amara. She's 7 years old. And the parent just noticed that Amara began wetting the bed. Again, probably when she was a child, she was bedwetting, but she stopped. But all of a sudden, she started bedwetting again, refused to visit the friend's home, and stopped playing with toys she previously loved. When you look at this story very well, you will discover that there's this regression that is beginning to happen. That means in her sleep, she's beginning to bedwet. Then secondly, she's beginning to avoid places. When you see a child avoiding places of interest, places that child was always eager to go, Amara stopped visiting and stopped playing with toys she previously loved. This is a case of abuse. And you know, Amara is just 7 years old. And if you're not careful, you will look at it that what a 7 years old as a parent will kind of send her away without really finding out what the problem is. But this is a sign of abuse, and the parent will have to give much attention on Amara to be able to know, why is she bedwetting? Why is she refusing to visit a friend's home that she was used to going before? And why is she refusing to play? These are three critical things that show that Amara is traumatized. Then another situation is James, who is 13 years old, groomed and abused by an older teenager online. You know, most of times we give attention. Parents who try to give attention, they give attention to the physical environment. But I want to let you know that so much abuses are going on online that we don't give attention to. James became secretive, agitated, and began showing inappropriate sexual knowledge. You know, somebody tell me a story. A mother told me a story of a child who was initiated online into lesbianism. Online, somebody initiated her teenage child into lesbianism online. So there is this online initiation or online activities that is going on. If care is not taken, it gets out of hand and the child grows with that. So there are a lot of abuses. There are a lot of abuses that is going on online or on site, at home, in school, outside in the environment. So these are kind of abuses that children go through that we need to give attention to. We need to understand that children who are traumatized may hardly say it. They can be traumatized at home or in school, but it can be seen in their attitude, in their relationship with others, or in the way they act. When you see a child all of a sudden becoming stubborn, check, something is wrong somewhere. Children don't suddenly change like that. Something happened. So some of these abuses can make children to start behaving somehow. They can start some maladaptive behavior, or they will withdraw, or they will overeat or undereat. So we need to give attention to some of these things. So I will want to give opportunity for questions I want to give opportunity for us to ask questions. But we should know that trauma is not a respecter of age. A child can be traumatized just like an adult. And trauma can affect a person into adulthood. If it is not handled at a very tender age, it can come a long way into adulthood, and it can disrupt normal functioning. And it will be very, very, very difficult to handle if it is not handled on time. It can even lead to mental health. It can even lead to some psychological issues and all of that. So I want to give opportunity for questions and answers.
Thank you very much, ma'am, for that wonderful session. Yes, the applause. I'm proud of you. People are applauding already. Yes, fantastic. Thank you. So please, if you have any questions, you can feel free to ask them quickly in the comment question, or you can put your hand up, and we would give you the opportunity to make your questions. And while we're waiting for you to type your question or think about the question you want to ask, I think for me, my key takeaway from this session is that you need to pay attention to your children, because if you are not observant, you may not be aware of some of these changes, because most of them are behavioral and emotional. So if you're not paying attention, you will not know that this thing has happened or something has changed about your child. And so as parents, we need to pay attention, not just parents anyway, as parents, as guardians, as people who are responsible for other children and other people, we need to pay attention so that we are aware. Okay, so okay, somebody's hand is up. If I don't get the name correctly, so please, yeah, you can unmute yourself and ask your question.
Oh, sorry, I didn't mean to put my hand up. I didn't know when I did that. I'm so sorry.
Okay.
I'm sorry. Yeah,
all right. So I'd like to ask a question. I'd like to ask, are there less observable symptoms or signs that children would show if they are abused? Maybe things that are not always seen. Are there certain behaviors that are less obvious that children can display as a result of sexual abuse? And what may these symptoms be?
Okay, some of the behaviors that are not always common are languages that children begin to speak, especially if it has to do with online abuse. The child begins to speak some kind of adult language that is not common with his peers and age. And another thing is that the child begin to like practice what happened. You have to be very sensitive to notice that this child is either the child climbs a bed and begin to do exactly what was done to him or her. It's not very common though, but children can dramatize what happened to them. You will agree with me that children in the place of play, they do a lot of things. And as a parent, it is good when children are playing, sit down and watch them. You will get to know everything that is happening with them. They cannot say it, but they can dramatize it in the place of play. That happens with children who are not withdrawn from their peer group, who still play. Children who still whose social life is not affected by what happened. They tend to dramatize it with their peer group. You will notice that. Then you will notice that their language are changing. apart from the withdrawal we talk about, apart from the flashback, sleep disorder, eating disorder that we talked about. Another thing is that if you're not careful to pay attention to the private part of your child, you will not know that something happened. It's not common because not every parent puts attention to the private part of their children. But it's very important that once in a while, when washing your child's private part and the child is screaming, open the private part and check. You will know that either there is a wound, some wounds are not visible. There are some that you may not see the wound, but the hand of the child is painful. You're touching the child is saying, my hand is paining me. What happened? The child cannot say it. Probably if an adult did not mishandle the child, it can lead to dislocation, which you cannot see until you go to the hospital. But beyond that, the private part of the child, you must watch it carefully. If not, you will not discover what happened until it gets healed. And because the child is muted, he or she will not be able to say what happened, especially if the abuser is in the house. They can injure the child and treat the child without the parents' knowledge. Because if the parents are used to going somewhere and leaving the child in the care of the abuser can injure and treat the child without the parents knowing. So we have to be very careful. We have to be observant. Even parents that are not always at home, when you come back home, check your child thoroughly. Because it's easier for you to come back home tired at night and just sleep without checking your child's private part because your house help is already bathing the child. The house help is the one taking care of the child. You don't even know what is happening in the body of your child because you're not always around. It's difficult for you to notice if the child is being abused. So some of these silent symptoms, you may not know if you're not careful, especially if you're a busy parent. Because the abusers are always around. They will take care of the child and try to win the child to themselves. You hardly can know. It's the behavioral that will begin to show up, and it will not show up immediately. Maybe later in life, before it will show up.
Thank you so very much, Mom. This was really insightful. Please, once again, a round of applause for her. Send her flowers, send her love, send her claps, all of that. We appreciate all of your insightful contributions. I don't know if Diana Maidawa wants to ask a question, but we are moving on to the next speaker. So just hang around. Don't forget that question. Write it down. Maybe you can drop it in the chat box, but we need to listen to the second speaker and then we can take any other questions.